All right, your child is sick. I mean, she just can't keep anything. So it's certainly not the time to panic, but we need to be careful. Vomiting indeed means losing what we have eaten and drunk since the last meal, or even more. It also means, of course, that since the time of that last digested meal, well, your little one has most likely not absorbed anything in terms of water and energy. In short, if, for example, she has vomited the content of 2 meals, these 2 meals were effectively skipped. But on top of that, she has also vomited the liquid produced by the stomach during that time, which means a loss of even more water plus substances found in the stomach, notably electrolytes. And these electrolytes are also important for the proper functioning of our body. Their balance in the blood is indeed critical, notably to maintain the right pH, that is the level of acidity in the blood. And so vomiting can lead not only to dehydration, but also to a loss of energy and to abnormal electrolyte and therefore blood pH level. So yes, vomiting is a bit of an annoyance. Okay, say you are at home in the train, in the plane, or more classically in your car, and your lovely one decides to throw up. What should you do? First, the most likely cause of a vomiting is a virus, which also often leads to diarrhea, by the way. We can indeed vomit for plenty of good reasons, but it is still more often because of a virus than because of a gut obstruction, for example. But of course, we need to be careful, as I have said at the beginning. Now, what should you do besides cleaning the mess? So to start with, remember these water and energy losses. So the first thing to do is to minimize the likelihood of yet more vomiting, because continued vomiting often leads us straight to the ER. Now, of course, there is no perfect trick, but the idea is to try as much as possible to put energy and liquid back in the system. So a first step would be to prepare a mix of food rich in water and energy, plus some varied food types. For example, a kind of porridge or puree made with rice or potatoes, not too thick and where one can add some eggs and vegetable. As much as possible, indeed, something that looks like a rather wet meal, containing water, energy and some nutritious food. Now, be careful with things like a lot of meat or a full egg or a glass of milk at once, because these foods contain lots of protein and lots of fat and will consequently further slow down the food digestion process, which in turn will make the refeeding process more cumbersome. There is another very important aspect to it. We need to multiply the opportunities of feeding, and that is because your child will only be able to eat a little at a time, which means that he will have to eat often if we want to catch up what was already lost and provide enough also to maintain what he needs in terms of water and energy and so forth. That means feeding 1 spoon at a time if necessary, every 10 to 20 minutes, for example, as tolerated. Quantities can be increased and progressively as your child starts tolerating bigger quantities without vomiting. Now, of course, I can already hear, all right, doctor, that is all very nice, but he literally can't keep anything and vomits even water. Okay, when kids haven't eaten for about 12 to 18 hours, they can develop what we call ketosis. Simply speaking, they start using their own body fat to produce energy, since their blood glucose level, that is sugar level, is low as a result of the lack of energy intake for all that time. It is actually a normal reaction that we all do whenever we are fasting. Ketosis, by the way, also produces a specific smell to the body, the type of smell that we can often, unfortunately, find in hospices and hospitals. The problem with that ketosis reaction is that it increases the tendency of vomiting, and so, well, this doesn't help us, since vomiting is the cause of the ketosis in the first place. The trick really, then, is to put some sugar back in the system. That is what is done through the vein when we are admitted to the hospital. But what about giving it a try before arriving in the hospital, or hopefully in order to avoid the hospital altogether? So you could, for example, try this trick, which is easy and non-toxic. So if your little one vomits everything, even water, try giving her sugar. Well, just plain white sugar, as much as she wants to eat it. But try to avoid at the same time adding water or other things, because she would then probably vomit everything, including the sugar. And so you would typically do that for about an hour, for example, before restarting the feeding of other food as described before. And your child should absorb sugar rather easily that way, stop the ketosis process and reduce his tendency to vomiting, which in turn would help with refeeding. Now, if that doesn't work, or if your child is indeed less and less active in spite of all your effort, well, it becomes then very clear that you will need to see the doctor quickly. Fortunately, this method seems to work well in my experience. So you could try it if you see that your child still has a reasonable level of energy to start with. Bear in mind, however, that smaller kids are more sensitive to the effect of vomiting, and for them the situation can very quickly indeed become problematic. It means that an infant, for example, can look very sick in a matter of hours, so be careful. I hope it was helpful. May the force be with you. Ciao.